So our topic is peptic ulcer disease, PUD, and Helicobacter pylori, H. pylori.
Here's just a general overview of what we are going to be going over for peptic ulcer disease. We're going to be going over the pathophysiology, causes, symptoms, risks, prevention, and medications. Peptic ulcer disease refers to a lesion that's located in either the stomach, which is known as the gastric, or the small intestine, which is known as duodenal. And a person who has a peptic ulcer has peptic ulcer disease.
Here is the pathophysiology of peptic ulcer disease. A peptic ulcer is a hollowed out area that forms in the mucosal wall of the stomach or the small intestine. It happens when the mucosal walls are getting worn down, known as erosion, and can extend to muscle layers. Peptic ulcers occur mainly in the gastroduodenal mucosa because the tissue cannot withstand the digestive action of gastric acid and pepsin, the digestive enzyme in the stomach that breaks down proteins to polypeptides. The erosion is caused by an increased concentration of activity by acid pepsin or by decreased resistance of mucosa. So the mucosa is damaged and they cannot secrete enough mucus to act as a barrier against acid. Moreover, the damage also allows for decreased resistance, making it more vulnerable, and increase the risk for infection by the H. pylori bacteria.
There are a few main causes of PUD. The primary cause of PUD is infection by the gram-negative bacterium Helicobacter pylori. About 50% of the population has this bacteria present in their stomach and proximal small intestine, and all patients with PUD should be tested for the presence of H. pylori. In non-infected patients, peptic ulcer disease is a well-recognized complication of NSAID use. So NSAID is another cause of PUD. Remember that NSAIDs inhibit cyclooxygenase, an enzyme responsible for prostaglandins formation, resulting in the reduced inflammation and pain. However, it also reduces the secretion of protective mucus and bicarbonate ions. And then other causes would be the ingestion of spicy foods and caffeinated beverages, smoking and alcohol. They also may increase HCl secretion. And stress and eating spicy foods may make the peptic ulcers worse. Stress-related mucosal disease, that means that stress is the cause of injury to the lining of the stomach.
Symptoms and manifestations. The first three symptoms here are associated with duodenal ulcers. So the first one is gnawing or burning upper abdominal pain is the main symptom of duodenal ulcer. Pain is worst on empty stomach and disappears on ingestion of food. The second one is nausea and vomiting, and the third one is if the erosion progresses deeper into the mucosa, bleeding occurs and is seen as either bright red blood in vomit or black tarry stools. Number 4 and 5 involves with gastric ulcers. So number 4 is the pain can be relieved by food, but pain can still continue after a meal. 5 is loss of appetite, known as anorexia. Weight loss and vomiting are more common here. And number 6, other findings can include pallor, epigastric tenderness, hyperactive bowel sounds, Guaiac positive stool, meaning possible with occult bleeding, rebound tenderness, guarding, and rigidity with perforation.
Here is Joseph Ania's story. He is a 46-year-old man, and he had felt a continuing unexplained pain on the right side of his abdomen for about 4 days. A few days before, he had gone to the emergency department where doctors suspected he may have a ruptured appendix or a leak in his pancreas. However, the doctors were struggling to figure out the problem, so he went home. But the pain continued to get worse. He went back to the hospital and was examined by a nurse, and after the exam, the doctor ordered a CT scan of his abdomen and pelvis. The results showed signs of a peptic ulcer. He had a perforated duodenal or intestinal ulcer, which can happen when the ulcer is left untreated and burns a hole through the wall of the intestine. And this causes the digestive juices and food to leak into the abdominal cavity. The ulcer was causing his colon to become inflamed, and if it had been left untreated for longer, he could have developed life-threatening infections. He was given antibiotics to treat any infections, that could be causing the colitis. His symptoms improved and he was eventually released from the hospital, but the doctor did recommend him to get an endoscopy to make sure that there were no serious immune system disorders.
So who is at the highest risk? Duodenal ulcers mostly occurs in men who are 30 to 50 years old, just like Joseph's case, whereas gastric ulcers are more common in women over the age of 60. Other factors can include having family history of PUD, being in the blood group O because they produce an increased inflammatory response to H. pylori compared to other blood groups, smoking tobacco, which increases gastric acid secretion, overconsumption of beverages and food that contain caffeine, NSAIDs, excessive psychological stress, and people with H. pylori infection.
Here's just a picture that shows how the H. pylori bacteria gets into the stomach lining, and basically it creates urease, which turns into ammonia, and this neutralizes the stomach acid, causing poor digestion, and it allows the H. pylori to thrive in the stomach.
Consequences of PUD. It can impact both the digestive system and the immune system. If left untreated, multiple consequences can occur. So, PUD impacts the digestive system because the acid in the digestive tract causes open sores to develop on the inside lining of both the stomach and the small intestine. It can also affect the immune system when the H. pylori bacteria is involved that causes PUD. If it's left untreated, it can result in internal bleeding, which happens slowly as the blood is lost and can lead to anemia or severe blood loss. Remember from the signs and symptoms, we said that ulcer disease can cause bloody vomit or black stool. There is a perforation, a hole in your stomach wall, where these ulcers can eat away the lining of the stomach or the small intestine and put the person at risk for develop peritonitis, which is the infection of the abdominal cavity. Moreover, it can cause an obstruction where it blocks the passage of food via the digestive tract, which can make you get full quickly and then cause the person to vomit and lose weight from the swelling or scarring. And lastly, it can cause gastric cancer, in which the studies shown that people who get infected with Helicobacter pylori have an increased risk of developing cancer. Just as you remember Joseph's story.
Some prevention methods for peptic ulcer would be to avoid tobacco and alcohol, limit caffeine, don't ignore your symptoms, use caution with aspirin and NSAIDs, and wash your hands frequently to avoid infections.
Now we will be talking about the required drug, proton pump inhibitors, PPIs. They act by blocking the enzyme responsible for secreting hydrochloric acid into the stomach. These drugs are the choice for short-term therapy of PUD. They bind permanently to hydrogen potassium ATPase, which stops the transportation of acid known as hydrogen or protons onto the surface of the GI mucosa. Some of the drugs that are under the PPI pharmacological class includes esomeprazole, lansoprazole, pantoprazole, rabiprazole, and most importantly, omeprazole, Prilosec. You will need to know this drug. It's important.
Omeprazole was the first proton pump inhibitor to be approved for peptic ulcer disease. It reduces acid secretion in the stomach by binding irreversibly or permanently to the enzyme hydrogen and potassium ATPase. It takes 2 hours to reach a therapeutic effect and lasts up to 72 hours. It is used for short-term 4 to 8 week therapy of active peptic ulcers. Most patients are symptom-free after 2 weeks of the therapy, and it is available by mouth and approved for pediatric use in children ages 2 and up. Some contraindications of this drug are hypersensitivity or allergy to proton pump inhibitors, and over-the-counter use is not approved for those under 18 years old. This drug can also be used for esophageal, duodenal, and stomach ulcers, NSAID-associated ulcers, gastroesophageal reflux disease, and Zollinger-Ellison syndrome.
The adverse effects are usually minor, such as headache, nausea, diarrhea, and abdominal pain. Sometimes rare blood disorders can occur that can cause usual fatigue and weakness. Prolonged treatment can also cause atrophic gastritis, which is the chronic inflammation of the stomach, and hypomagnesemia, which is an electrolyte disturbance caused when there is a low level of serum magnesium in the blood. Drug and drug interactions can affect the bioavailability of medications that depend on lower pH for absorption, such as ampicillin, digoxin, iron salts, and also antifungals. Concurrent use with warfarin may increase the likelihood of bleeding. If they have an overdose on Prilosec, there is no specific treatment.
Here are some other drugs that treat peptic ulcer disease and H. pylori bacteria. One of them is bismuth subsalicylate, and it's an antidiarrheal that is used for the control and symptomatic relief of acute and chronic nonspecific diarrhea. Some anti-ulcer agents such as amoxicillin, clarithromycin, metronidazole, and tetracycline also treat peptic ulcer disease, and their main goal is to treat the infection by eliminating the H. pylori bacterium. Antacids aim at neutralizing gastric acid, and the histamine 2 receptor antagonists are effective at suppressing the volume and acidity of parietal cell secretions.
Here are some pathophysiologic concepts that relate to PUD. For acid-base balance, peptic ulcers form when acid erodes the GI tract lining, causing the gastric mucosa to break and create ulcerations. With peptic ulcer resulting from H. pylori bacteria, acid isn't the dominant cause of bacterial infection, but contributes to the consequences. Duodenal bicarbonate secretion is also impaired, lowering the pH and lead to acid injury. For inflammation, H. pylori releases enzymes that can damage the gastric mucosa and stimulate inflammatory response that contributes to epithelial cell apoptosis. The inflammatory response results in the production of free radicals by neutrophils and damage the DNA of epithelial cells. For immunity, the immune response produces Th1 cytokines that further damage the DNA of gastric epithelial cells and induce apoptosis. H. pylori leads to the production of pro-inflammatory cytokines by gastric epithelial cells, which is the response to infection. Cytokines interact with gastric epithelial cells and will lead to the activation of gene alteration that helps the development of gastroduodenal diseases associated with H. pylori infection. As for hormonal regulation, it has been shown that H. pylori stimulates the increased release of gastrin, which is a hormone that causes your stomach to produce large amounts of acid. This extra acid damages the intestinal lining and creates peptic ulcers in your duodenum and the upper intestine. There have also been studies done that state that estrogen regulates human duodenal bicarbonate secretion, which could reduce the risk of duodenal ulcer in women and contribute to sex differences in appearance of duodenal ulcer. So which of the core concepts play a role in disease development? We said acid-base balance because it's the most important since it changes the pH levels in the digestive system to help form the peptic ulcer disease. The second concept would be immunity because it plays a role where it's unable to get rid of bacteria H. pylori and weakens the immune system, making it harder for the body to get rid of it. This bacteria manipulates important immune system cells known as regulatory T cells, which down-regulates the body's defense against this bacteria, allowing peptic ulcer to develop.
That is the end of our slideshow on peptic ulcer disease. Thank you so much for listening, and here are some references.